and then the apex, which is the pointy part. Okay? Right side, left side. Now one of the ways you can tell front from back is this apex is always pointing down and to the left. Okay? And then also in the back, we have this large vein going across the back that's only in the back. So that's how I can tell anterior from posterior. Okay? So we have the atrium, the receiving chamber. So we have a right atrium here, and there's a left atrium on that side.
Kind of in the back. Yeah.
Yeah, well, there's part of it too.
Okay.
Okay? Now what you're going to find, there's a little part that, they call it an auricle, because it looks like a little ear. Okay? And it's a little kind of flap of tissue at the bottom. Okay? But that's part of the atrium. Okay? Now if we open up the right atrium, we have 3 blood vessels that come in. We're going to have the superior vena cava. The inferior vena cava would be coming up through here, draining the upper body, draining the lower body. And then the third one was the coronary sinus that's draining the heart. So there's another hole in there. That's the coronary sinus. So those 3 things come into the right atrium. Okay. Now I'm going to remove the wall of the ventricle. So now I have a valve between the right atrium and the right ventricle. What valve is that one? Tricuspid. 3 flap valves. Okay? Tricuspid valve. The little white strings, chordae tendineae. Okay?
What are they?
Cords. Okay? They hold the flaps in place against the walls of the ventricle. Okay? Now from the right ventricle, the blood flows through the pulmonary trunk up here to go to the lungs, and that would be the pulmonary semilunar valve. Okay? Blood goes to the lungs, goes into capillary beds, gets oxygenated, comes back to the left side of the heart through 4 pulmonary veins. So there's 1, 2, 3, 4. Okay, so they're going into the left atrium. Then we go through the bicuspid valve, 2 flap valve, into the left ventricle, and then the blood gets pumped into the aorta, and the aortic semilunar valve is hiding behind everything up here. Okay, and going into the aortic, ascending aorta, aortic arch. Okay. Now a couple other things you can see on here. We can see this would be that brachiocephalic trunk. Okay, on the right. This would be the left common carotid. And then this would be the branch of the left subclavian artery. And then the aorta is going to continue down and go into the thoracic cavity, abdominal cavity.
They all branch off the aorta.
The aortic arch has 3 branches off of it. Okay? Now the other thing we can see, right ventricle wall is very thin. Left is very thick. Low pressure system, high pressure system. So you can see the difference in the anatomy with that. The only other structure is the coronary sinus, and that's this structure back here, a large flat vein in the back of the heart that drains the cardiac muscle of the venous blood supply. Okay? And then that drains into the right atrium. Okay? Now, fossa ovale, all right, remember it was the whole opening between the right atrium and the left atrium, closes at birth. Okay. Now, on this model, the fossa ovale is an indentation right in here. Okay, it's labeled G. Okay, it's on the other models too, but what you're looking for on the pig heart is it looks like a different color. Where the other stuff is kind of that reddish brown, the fossa ovale is going to be gray. Okay, kind of a gray brown because it's connective tissue. It's not cardiac muscle. Okay. So that's going to be the closure between the 2 atrium at the time of birth. Okay? So that's the overall anatomy where it looks all nice and